Having dry eye syndrome or dry eye disease is a lot more complicated than just not producing enough tears. Dry eye is multifactorial, meaning your eyelids, medication, lifestyle, medical diseases, all of these play a role. And for your doctor to find the best treatment for you, you're going to want to sit through a thorough dry eye examination. So in this video, I'm going to walk you through the dry eye examination that we offer at our clinic, showing the different dry eye tests, how they're done, and what they mean to me as a doctor. That way you will know what to expect at your dry eye examination and what those results mean in finding the best dry eye treatment for you. So blink your eyes a few times, smash that like button, and let's take a look. Hello and welcome, this is Dr. Joseph Allen here from the Dr. Eye Health Show, and today I'm super excited to be talking to you about the dry eye examination and all the dry eye tests that we offer at the clinic that I work at called the Pinecone Vision Center in Sartell, Minnesota. Now right away I do want to mention that the examination that we're walking through and all these tests are pretty comprehensive compared to a lot of other clinics that I've been to, so depending on where you live and what different dry eye specialists in your area may offer, you may not see all of the tests that we're doing. But my hope through this video is whether you come to see us or you do see another dry eye specialist, that you'll better understand what all of the tests they're going to be doing and what they translate to, like what they mean to us as your doctor and how that helps us guide what treatment's going to be best for you. So if you were to come into our clinic for a dry eye eval, our technician would first greet you, bring you on back to the exam where they would check your eyesight, your vision, they would make sure that your eye pressures are doing okay, and then they're going to take a thorough history just to make sure that we know what is going on medically, your past medical history, surgeries, any sort of medications that you've been on, and if you have autoimmune disorders, all of those things. You'd be amazed to learn how many medical diseases, autoimmune disorders, and different like skincare medications, all these things can affect potentially how our eyes are feeling, inflammation, and leading to dry eye. So again, a thorough history is really important and honestly never ends throughout the entire exam. I'm usually asking my patients tons of questions throughout an exam. Now, one thing that we use at our clinic is a dry eye questionnaire. This is where a patient will fill out some basic questions about how their eyes are feeling in terms of dryness, how often, how severe they are, and that all gets calculated out to a score. And we like to do this at every evaluation so we can track that score over time to make sure that if we do start a treatment that we are having a kind of relief for those symptoms. This is also good for us to document because some patients, their eye will not look like dry eye. In fact, it'll look pristine and perfect, but they're still having these symptoms, and that tips us off that perhaps it's not dry eye. In fact, it could be a neuropathic pain issue. So again, just a good thing to document. Now, one of the first true dry eye tests that we do in our clinic is called tear film osmolarity, which is really just a fancy way of saying that we're measuring the salt content of the tear film. If you remember the last time you ever did cry and you tasted your tears, they taste salty, right? And that's because with dry eye syndrome, there is an irregularity of the tear film, which causes an increase in this osmolarity or increase in salt content. And that causes a disruption or loss of homeostasis to the front surface of the eye. Now, the device that we have is called the Tear Lab, and it's very simple. It just goes up to the side of your eye and it takes a small sample of your tears. And then it reads us off a number in milliosmoles per liter. In general, anybody with less than 300 on their osmolarity is considered fairly normal, but anybody that's above 300 does mean that there's a loss of homeostasis or balance with the salt content. And with increasing amounts, the higher your osmolarity, if you're getting up to 320, 330 and above, you're getting into more severe cases of dry eye. And as a doctor, I'm not just looking at the pure number, I'm also looking at the asymmetry between the eyes, as well as the fluctuation from exam to exam. But overall, the osmolarity, I believe, is an important test, mainly because if I have a patient who is symptomatic for dry eyes, but their osmolarity is normal, then I need to be thinking as a doctor, okay, this may not be dry eye. This could in fact be blepharitis, or maybe an allergy of some kind, or perhaps maybe this is the second or third time we've done this and we've started you on a treatment and that treatment is starting to have an effect. We're seeing in normal levels again. That's why osmolarity testing can be so helpful for dry eye. Now, the next test that we do is something called Meibography. This is an imaging or scanning technology that will scan both your lower and hopefully your top eyelid. Sometimes the top eyelids are tough to image, but the lower ones are the most important anyway. But we scan your eyelid specifically to look for how many oil glands remain. for a lot of people, these oil glands in your eyelids, which we call the Meibomian glands, can eventually get inflamed and clogged up and potentially even atrophy or die off for some people. Now, here on this channel, we've covered a lot about Meibomian gland dysfunction and this specific issue with the oil glands, a lot of other videos. But in short, if you haven't seen that, Meibomian gland dysfunction, or this problem with the oil glands, is very common. And it happens to be that when your glands aren't functioning, or they're not producing either enough, or the type of oils they are producing are very low, your tear film evaporates very quickly. And that causes a problem with too much salt content and this unstable tear film, and hence dry eye. Now, purpose of scanning the oil glands and getting this meibography really serves two purposes. One is to show us how many glands are there and if they're inflamed or if they're in trouble. And two, the instrument also takes an active measurement of the oil layers on the tear film itself. And I personally just love looking at the images of the lipid layer itself because you can see kind of this cool rainbow color on the front surface of the tears, which honestly reminds me of seeing gasoline or some other type of fuel floating on top of like a puddle on the road or something. But being able to see those oil layers active on the top of the tear film is very powerful. And then furthermore, being able to quantify that and being able to say, hey, yes, your glands are there. We know you have oil glands, but they're not producing well enough. And so we know that the quantity is very low. And in a case like that, then we're definitely thinking about a treatment such as a thermal pulsation like LipiFlow, for example, or perhaps an IPL or something to help with those Meibomian glands. And same thing for after a treatment, we can always repeat this test and then being able to show, hey, are your warm compresses even being effective? Now, the instrument that we use also tracks how our patients are blinking during that evaluation because a lot of people, including myself, are incomplete blinkers. We don't blink all the way, and so we can capture that and see that might be one of the reasons why someone's having such bad dry eye. Now, the next test in our dry eye exam is that of measuring with Inflammadry. This is a test that kind of looks like a pregnancy test, but it really just helps sample the tears, and then after it's run, will tell us the presence, positive or negative, if a patient has a biomarker called MMP9, which its whole name stands for matrix metalloproteinase 9. Try to say that one 3 times fast. Now, this MMP9 is an inflammatory biomarker. Basically shows us that there is presence of inflammation, which is consistently found in patients with dry eye. Inflammation also plays a major role in the cyclical nature of what dry eye is, and is one of the major reasons why conservative dry eye treatments often don't end up giving us any results. Because if you not just have dry eye, but then you have the inflammation present at the same time, the inflammation kind of just acts like adding gasoline to a fire, making it worse and worse. So if a patient does have this signs of positive inflammation on the eye, that's why your doctor is going to think about prescribing either a topical steroid or a medication such as Xiidra or Restasis to help get that inflammation under control. I personally find that topical steroids are really good with patients who have bad flare-ups, but again, long-term, there are some safety concerns, where other medications like Restasis and Xiidra, they have a better safety profile for people who need long-term treatment. Now, from here, the next part in dry eye testing is legitimately measuring the quantity of tears that somebody produces. Historically, there have been 2 tests used primarily in research to measure the quantity of tears. This is either through what is called Schirmer's testing, or another one which is called the phenol red thread test. However, the phenol red thread test is no longer being manufactured, so you may not see that anymore. But in general, Schirmer's testing is where your doctor will put a special piece of paper on the lower eyelid, and then that will absorb tears for a certain amount of time. In general, if somebody produces more than 10 millimeters of tears in a 5-minute period, then they're considered to have more normal tear production. But if somebody has less than 10, then that is significant for dry eye disease. And if somebody has something like 5 millimeters or less, then I'm seriously considering if somebody has an autoimmune component, like something like Sjogren's syndrome, for example. But on the flip side, if you can imagine somebody producing a lot of tears, like 20 plus millimeters in that time frame, then we're not so concerned about them not producing enough tears. We're more concerned about the quality of tears, and perhaps the tears are evaporating too quickly. All right, so let's move on and talk about the slit lamp examination. This is where your doctor is looking behind the microscope that we call a slit lamp so that they can see what's going on your eye at that moment. Now, with the slit lamp exam, we do what's called fluorescein sodium staining. Fluorescein sodium put onto the tear film will highlight any defects, any surface damage, anything going on the front surface. One of the major things your doctor is going to look for during this test is something called SPK, or superficial punctate keratitis, which is basically a type of surface damage that's occurring where the front epithelium of the cornea is starting to get little divots, almost little erosions due to the dryness that's occurring. But depending on how that SPK or these little surface damage are showing up, that'll tell us more about the potential cause of the dryness and all the symptoms. For example, if it's a very diffuse SPK, then we may be concerned that perhaps somebody's medication that they're using, like antibiotics, may be in fact causing a toxic reaction to the cornea. Or if somebody has just a very defined, like lower 1/3 of their cornea, then we're thinking that perhaps there's an exposure issue, that maybe their eyelids aren't closing all the way while they're sleeping. These are just a few examples, but it's a really important thing for your doctor to be looking for. In fact, just a pro tip for any students or other doctors who may be watching this, I highly encourage you try a yellow Ratten filter. You will see a lot more subtle SPK and other surface damage that could be going on. Okay, another thing that we use that fluorescein staining for is also measuring for what is called T-BUT, or tear breakup time, which is really done easily. Your doctor's just looking at the eye, asking you to close your eyes and then open them up and hold them open while they're observing for how the tear film on the front surface of the eye separates and breaks up. And while that's occurring, your doctor is counting back in their head from 0, 1, 2, 3, and then once the tear film has broken up, then they know your tear breakup time. But historically, a decreased T-BUT measurement is associated with a poor tear film quality, mainly surrounding the Meibomian glands and then not producing enough oil, or the oil is poor quality. Now, other than fluorescein staining, we do use another stain, which is called Lissamine green, which is just a kind of a stain that gets put on your tear film. And yes, as you can see here, it does look rather dark green. And I know a lot of patients who do kind of freak out because of how green their eyes will look during this part of the exam. But Lissamine green is a dye that stains devitalized cells, or surface cells that have lost their glycocalyx or their mucin layer, which I find is very good for staining the conjunctiva, the outer clear coating on the white part of the eye. Because for some people, the cornea may look great, they're not having any surface damage there, but in fact, the damage is all on their conjunctiva, and you can see they have no mucus layer, and they're just having extreme staining there. So dry eye is really not just about the cornea, it's about the whole eye. Your doctor has to be looking at everything. And with all the staining, your doctor is also observing for deformities of the cornea, such as scarring, post-surgeries, as well as corneal dystrophies, for example. Any scenario where the front surface of the eye is not normal or regular. Now, outside of just looking at the front surface of the eyeball itself, a big part of this examination is also looking at the eyelids. First, expect that your doctor's gonna push on the margin of your eyelid just very gently to try and express some of the oils trapped in those Meibomian glands, because they want to see the quality of those oils. First, we want to see that oils are coming out, and ideally the oil will come out like a smooth olive oil or something like that. But unfortunately for a lot of people, when there's inflammation present, we can see those oils coming out as kind of a milky, cloudy appearance. Or for some people, it's almost like popping a zit or watching wax slowly ooze out of those glands. And outside of expressing these glands, we're also noting any presence of spider veins on the eyelids, which we call telangiectasia, as this is more of a marker that there's been prolonged inflammation of the eyelids, and somebody may have potentially ocular rosacea. But your doctor is also going to take note of how the eyelids are coming together. Are they actually coming together all the way when they're closing, or are they only, again, partially blinking? Also with how the eyelids are scraping on the eye. I often have my patients look down, and then I lift that upper eyelid, looking for any signs of redness or new inflammation there, because that could be a sign of SLK, or superior limbic conjunctivitis, which may be an early sign to me that a patient has thyroid problems. Okay, so from all of this, we now know the quantity of tears someone is producing and if that's playing a role, the quantity and quality of the oils that are being produced, and if somebody's glands are present on the eyelid. We know if blinking or exposure is potentially a problem, if inflammation and surface damage is contributing, as well as a medical history and medications, as well as a survey to base our future treatments off of. All of that gives us a good idea if a patient has aqueous deficient dry eye, do they have evaporative dry eye, do they have a mix of the different types of dry eye, and at the very least, it gives us a good baseline to base our treatments and to monitor our treatments if they're successful down the road. Again, that way as we begin treatment, whether it's an in-office procedure or a medication, I can have the patient back and I can see the data if things are improving. That way, hopefully, the dry eye treatment is not just a random guessing game. Now, I do have one other test that I want to talk about, and I know a lot of other clinics don't do this test, but first, let me know in the comment section which part of this video really helped you out the most, or helped you at least learn the most about dry eye and dry eye testing. I'd love to hear your feedback. But the one other test that we do is that of corneal sensitivity testing, specifically using what is called a Cochet-Bonnet test. The Cochet-Bonnet kind of looks like a pen, but when you extend it, it looks like fishing line kind of comes out to a certain length. And when this line is fully extended, the tensile strength is very low, but your doctor will literally come toward you and just barely touch the front surface of your eye. And you'd be surprised how many people cannot feel that. If somebody's corneal sensitivity is normal, they should feel that even at just a little bit coming close to them. But when people have severe dry eyes, there could be corneal sensitivity issues where the neurological connection between the nerves of the cornea and the brain aren't communicating correctly. And this miscommunication can result in decreased tear production and poor healing of the corneal surface. And thankfully with the Cochet-Bonnet, we're not just testing, hey, is it there or not? We can legitimately quantify it and watch it improve with proper treatment. But again, that's a very specific test, and I don't know of many other clinics that have that specific test. Now, hey, I really hope this video helps you out in better understanding what to expect at your next dry eye exam. But I know that a lot of clinics, depending on where you live, may not be as comprehensive as what we've talked about here. But I do encourage you to find a dry eye specialist in your area. For help on finding a dry eye specialist in your area, I did some research and trying to figure it out myself. It turns out to be a little bit more complicated, but I built kind of a how-to guide, and I encourage you to check out that video up over here to learn a little bit more. Otherwise, thank you so much for watching. If you enjoyed the video, hit the like button, subscribe to the channel if you're new. Otherwise, again, this is Dr. Allen here from the Dr. Isle Show. Keep an eye on it, and we'll see you soon.